Hello and welcome to Pathology Podcast brought to you from St George's University of London. The title of this podcast is a preparation of tissue for electron microscopy. As we go through this podcast, we aim to revise the preparation of a tissue by giving you an overview of the protocol followed at St George's. Furthermore, this podcast aims to help increase your understanding of the usefulness of this technique. Let's get started. So you will need a specimen. Once the lab receives the specimen, the sample is logged onto a computer spreadsheet with the type of specimen and potential dates for completing each stage of the process. The sample is also given a unique EM number to help identify the specimen throughout the process. Other chemicals and pieces of equipment required to carry out this examination are a pipette, heat plate, a stopwatch, filter paper, a rotator, a diamond knife boat, a wooden applicator stick, an eyelash brush, thick glass to be used as a diamond knife, an ultramicrotome, a glass slide, cover slip, distilled water, filtered deionized water, grids, and a grid holder. The chemicals required for this preparation are 4% glutaraldehyde in 0.2 moles per liter, calcolidate buffer at pH 7.2, 1% osmium tetroxide, ethanol at concentrations of 35%, 75%, 90%, and 100%. Propylene oxide at a mixture that contains 50% of propylene oxide and 50% of spurs resin. You will also need 100% resin, 0.1% of toluidine blue, uranyl acetate, azure 2-methylene blue stain, basic fusion stain, mountain media, chloroform, and lead citrate. Now that we have all the apparatus, let's get started. So the first step of preparation of a tissue sample for transmission electron microscopy is fixation. Before you start treating the specimen, make sure it is less than 3 millimeters. The perfect size will be 1 millimeter. Leave the specimen in glutaraldehyde at room temperature for 4 hours. Then treat the specimen with calcolidate buffer twice for 30 minutes. The next step is known as embedding. Embedding can be split into 3 stages: washing, dehydration, and encapsulating. At stage 1, washing, you will need to remove the buffer and fix the sample with osmium tetroxide and put it on a rotator for an hour. The osmium tetroxide is then removed and the sample is rinsed in calcolidate buffer twice for 30 minutes each time. At stage 2, dehydration, wash the sample with different concentrations of ethanol. The sample is washed in each concentration twice, 30 minutes each time. So starting with 35% to 70% and finally 90%. Therefore, the total time for this step would be 3 hours. The sample is then dried in absolute ethanol for an hour and then transferred to propylene oxide for 30 minutes. After that, treat the specimen with a mixture of propylene oxide and spurs resin and then put them on the rotator overnight. The next day, transfer the specimen into 100% resin twice for an hour each time. Make sure that the specimen is on the rotator for any other waiting times. Here a specimen label is printed with its unique EM number and tissue type using Microsoft Word and a font size of 5. The label is inserted into the neck of the embedding mold or at the base of the coffin mold. The final stage of embedding is called encapsulating. Fill the capsules with the specimen and 100% resin and keep them overnight at 60 degrees C. Then remove and separate the capsule and the block with the specimen using a sharp edge razor blade. At this stage, the date must be logged onto the computer spreadsheet. The third and final step for the preparation of a specimen is called sectioning. For this step, you will need to cut a thick glass at a 45-degree angle using a glass knife maker. This will be used as a knife to trim the block created during encapsulating. Place the knife in the knife holder and tightly fasten the holder. Advance the knife in the holder to within 1 mm of the block and clamp the holder in position. You then need to fill a diamond knife boat with filtered deionized water. Using an ultra microtome, cut 1 to 1.5 micrometer semi-thin sections of the block. Before you remove these sections, take a clean glass slide and add a drop of filtered water on it. Then you may remove these sections from the boat using a wooden applicator stick and transfer them to the drop of water on the slide. Place the slide on a hot plate with a temperature of about 60 degrees C so that the section can adhere to the slide. Allow the sections to dry via heat fix for about 5 to 10 minutes to prepare them for staining. Firstly, the sample is stained using a drop of Azure 2 methylene blue stain onto the section and left on the hot plate for a minute. Then, rinse this stain with distilled water, blot dry with this filter paper and place it on the hot plate to dry. The sections are then stained for the second time, but this time with basic fusion stain, and then heated for a minute. Again, rinse the stain with distilled water and blot the slide with filter paper and again leave it on the hot plate to dry. You then want to place a drop of mounting media onto the slide and place a cover slip over the sections. At this point, you must check your sample is adequately prepared and stained to be examined by observing it under light microscope. This is called the quality control for tissue embedding and histology staining. To check if the sample has been adequately fixated and to see the quality of the sample, it is examined under the microscope. If the sample is poorly fixed, it must be re-embedded. The next step in the sectioning stage is known as ultra-thin sectioning. For this step, you want to use the same diamond knife and place it into the knife holder and fasten the holder at a clearance angle of 6 degrees. Again, advance the knife into the holder to within 1 mm of the block and clamp it in position. Fill the diamond knife boat as done in the previous step and then advance the knife until the thin slit of light begins to appear yellow. This is now approximately 1 micrometer from the specimen face. Then manually cut the individual sections to start sectioning and then activate the motor and begin cutting continuous sections. Adjust the thickness setting until you obtain goldish silver sections. Expand the sections by placing a drop of chloroform on the tip of a wand and wave it over the sections. Be careful not to dip the wand in the water or touch the knife or sections. To collect the sections, pick up the grid stored in the Petri dish filtered paper with the darker side facing up and bend it towards at about 30 to 40 degrees. Then carefully place the grid under the water in the knife boat and using an eyelash brush, guide the sections towards the grid and pick up the sections from the surface of the water. To get rid of any excess water from the grid, gently touch the rim of a wedge of filter paper. Finally, transfer the grids to a grid holder. The next step is known as post-staining. You will need to set up 2 stations to carry out this step. Each station needs a Petri dish, filter paper, and distilled water. However, the first station will have uranyl acetate and the second station will have Sato's lead citrate. Place a square piece of parafilm in the Petri dish in preparation for the grids. Using a clean pipette, place a drop of uranyl acetate on the parafilm of each grid you intend to stain and place each grid onto the separate drops of uranyl acetate with the sections facing down. The grids should sit on top of the drops. Cover the Petri dish with a lid for 10 minutes. Rinse the grids gently by dipping each grid into distilled water 40 times, then place the grid section side up and blot the grid dry using the outer edge of the filter paper. Repeat this whole procedure, but now using Sato's lead citrate instead of uranyl acetate. Finally, store the grids in a protective grid case in preparation for imaging. Now that the tissue has been treated with many chemicals and dyes, it's time to examine the specimen. So let's take a quick look at the results on a Hitachi 57100 transmission electron microscope equipped with a GATAN 1K digital camera. The prepared sample is analyzed under the TEM and an imaging report is created. So let's take a look at the results of the treatment so far. Once the sample has been analyzed under the microscope, it's time for the second quality control check. Check to see if the ultra thin section is thin enough to be viewed on a TEM and check for the quality of the stain. If you find that the sample isn't well stained, you may restain it. Once the sample has passed the second quality control check, it can be sent to the technician for imaging and a report is written up. The technicians will then examine the specimen to see if it's good enough for image analysis. Here you can see what the sample should look like when being examined under the microscope. Once the specimen is analyzed, the EM image analysis report is created and the date completed is logged onto the computer spreadsheet. And that's it. Thank you for watching. We hope this podcast was useful to you to an extent in explaining and educating you about the preparation of a tissue for electron microscopy image analysis.